Should we start now?
Yep.
Okay. Okay, welcome everyone to join today's meeting. Today we're very honored to invite Dr. Cui to give us a virtual presentation. And Dr. Cui, he is a well-known physician in our area, and he was recognized as the fellow of the American College of Physicians for the high quality of care he provided to his patients. And he's also the immediate past president of the Association of Chinese American Physicians, Mid-Atlantic chapters. And I'm not going to read where he got all his degree stuff, but he's very well recognized in our area and very respectful. He provides a service to our patients in many aspects. Specifically, right now at this period of pandemic, he served a lot of people with the COVID-19, and we also have a resident nurse, Zhen Yuan. She also worked in COVID-19 ICU with Dr. Cui. So we have very two respectful people to work with the first-hand experience with COVID-19 and give us the presentation of current trend in our local area and maybe provide us some advice for expecting the reopening of our local communities. Without further ado, we welcome Dr. Cui give us the presentation. Thank you.
Thank you, Lily, for the introduction. My name is Dr. Cui. I'm a primary care doctor practicing in Rockville, and I'm in internal medicine board certified. And first of all, it's my honor to be invited to talk with our community with the help of PTSA. And obviously, PTSA did a lot of wonderful work to help the parents and the children during this extremely unusual time of our human history. As you know, that COVID-19 is a very, very vicious virus, and it's so bad that it's extremely unusual. And so that's why we call it the historical time of our human history. Right now, we in the whole world, we lost over 5 million. I'm sorry, we have over 5 million people infected. And in America, today we have over 1.6 million American infected and close to 100,000 people lost their life. So today I would take this opportunity to share with you my knowledge and about this disease. You probably heard a lot of things about COVID-19, and so we're going to go over that, and then at the end of the talk, I would like to answer your questions. So today I'm going to talk in this 4 aspects. First of all, I'm going to go over what we did, what happened, and then we're going to talk about the current situation and the risk that we are facing right now, and update our prevention and treatment. So there's a simple timeline. In the beginning, in January 23rd, 2020, at Wuhan, in the city in central China, locked down because of the break up the coronavirus. And then American government immediately reacted to this unusual, huge scale situation in China. Therefore, American border was shut down to Chinese tourists, the travelers. But unfortunately, we are in the global village. American are not simply protected by one border was shut down. Therefore, so not long after that, the people who carry viruses came primarily from Europe, came to our land. So in Maryland, Mr. Hogan declared a state of emergency in March 5th, and subsequently has complete lockdown in March 19. President Trump declared the state of emergency because of public health emergency March 13th. So then, obviously, there's so many countries in this world was affected by this disease. And then every country tried its best to fight against this COVID-19, but given the different cultural and political system differences, each country uses a different way. So basically, in general, strategy against COVID-19 include two different strategies. One is we call it suppression, meaning is that we try to hold the disease in a small scale as possible, and then the rest of the population is not going to be affected by this disease. And this strategy was taken by China, Korea, Hong Kong, and Taiwan in this countries or area. But we in America, we take different strategy. We call it mitigation, because we understand that the disease is going to go to our community. It's going to affect a lot of people. This is basically probably inevitable, and we can't avoid it. But when this first wave of diseases come, what we worry about most. So I'm going to show you the picture here. So we call it the flatten the curve. So the first curve here is when the disease come, when the disease come, and then we don't do anything, and obviously a lot of people are going to be affected. A lot of people are going to be sick. Therefore, they're going to rush to the hospital, which can very quickly compromise our health system, and which make their service, health care, terribly compromised. And also those people who don't have COVID-19 infection may not have the medical services because this system melting down. So we try to avoid this curve. We try to make those people who are affected by the disease come slower away, and to the extent that our systems are able to handle those patients. So that's what we're trying to do in the past 2 months. And then you may ask, okay, so since right now a lot of the states start to reopen, what about it? Did we really reach that goal? Okay, we'll show the data here. So the Institute of Health Metrics and Evaluation, and this is a independent research center at the University of Washington. So they collected data and show our picture here. So this is based on the American data. Now here, the first, the dash wave shows that this is the wave of the disease is that without any intervention. So that's a huge wave. And here the solid yellow lines shows that the real data that how many patients was affected. Therefore, you can see there is a big difference. And also you can say the trend here is that in May, after May, look like this, it is going down. And then at the very beginning of the disease, and we are everywhere is short of testing. So now American catch up this part is very quickly. So testing is going up, but however the disease, the daily increase of the new diseases actually going down. So look at it. What we did in the past 2 months, it did work, did help. And this is a newly infected patient's number. And then next, this slide shows that this is a daily death. And you can say that the daily death did decrease, especially after, look like after May, it is going down. So that is the basis that's a phase that a lot of different states start open. However, the situation in America varies a lot. Different states have different strategies and a different situation. And what about in our Maryland? What about the situation here? So now we can say that this is a daily infection rate number that in Maryland. This is projected curve. Look like we in our state we projected that after May 1st, and then we are going down. However, the real number is still keep high. We really can't say that trend. So, and for the death rate, for the daily death is also look like it's still keep high here. And then, because I tracked those numbers myself too, so this is a picture that I did based on the data published. And then, although there's some peaks here, but spikes here for one daily increase a lot. But the trend here, you can see the trend here is still in plateau. Oops. And there's no clear-cut trend going down yet. So our current situation is that, yes, Maryland, we are still in a peak of this COVID-19, and Montgomery County is the same situation. We're in a peak. So now, the risk that we are facing right now is that 2 months ago, we were talking about the risk of the disease, but now we are facing the higher risk because in our neighborhood, in our community, there are a lot of people already infected, and some of them may be still infectious. Therefore, the risk for us actually increased compared to 2 months ago. Although we did successfully flatten the curve. So now, yeah, 2 months ago we were talking about the wolf is coming, but now wolf has come. Now, what should we do? Because in the past two months, we got so many bad news, and the people start feel anxious, and also our life seems getting harder, and we do want to reopen. What should we do? Well, fortunately, we are in the past 2 months. We did make a lot of improvements. We are getting better. So I'm going to over with that. So first of all, we know this disease is better. Obviously, right now we have 1.6 million American infected, and yeah, a lot of people even lost their life. But fortunately, the doctors and nurses are working hard, and we try to understand this disease better and to fight with it better, be more confident. So here, so the picture here show you that this is real virus, this notorious SARS-2 virus. It is extremely small, but this tiny virus we can see, we can feel, stop the whole world. It's just that simple. And then so this picture is taken under the transmission electron microscope that can see virus. Now, so how does virus spread? So it primarily person to person, and so this is the major route of transmission by close contact, meaning is that we within 6 feet, about 2 meters, and by this respiratory droplets, and also some of those people who are able to transmit disease, but they don't show any symptom. There are cases like that. Can stew pass the disease? Probably can. Right now, the pathology from the autopsy of pathology down to those people who passed away, we found a lot of viruses in the gut. Meaning is that yes, stew can. So that's why the wash hands after bowel movement is extremely important. It can possibly pass the virus to other people. And the surface contamination and touching mouth, nose, eyes, it can, but it's not a major way to spread the disease. And then the risk from animal to people, people to animal, this risk of transmission is low. Well, okay, since the COVID-19 is a disease primarily transmitted by aerosol or by respiratory droplets, then there's a study show how bad it could be. So this is a high-speed camera. It caught at the moment that people cough. Here's a mouth, and then here's a big droplets, and then here's a small fine droplets that can fly away as far as 8 meters. 8 meters, yes. One cough or sneeze can go as far as 8 meters. And here in New England Journal of Medicine, a leading medical journal, also used a thermal camera to catch the moment that people cough or sneeze. So here without face mask, and this whole area was contaminated. And here with the surgical face mask, and in this area was contaminated, but with N95 face mask, and only there's almost nothing changed. So you can see clearly the difference, the face mask, how important the face mask in this situation to prevent the disease get out of the mouth of the patient. Fortunately, American people catch up very quickly, and you can say that in your neighborhood, in the shopping center, here's the outside of a Costco, and people put on face mask and also practice social distance. Okay, what about the disease itself? Yeah, we heard a lot of the sensational stories, but reality is that based on the data, this is data from China that because they have and then on let's say 44,000 patients here, the majority of them, 81%, more than 80% of the people have mild symptoms. Well, what does it mean by mild? They may have they may have fever, cough, a little bit shortness of breath, but it's not so severe they need to go to the hospital. But 14 of those people, they get severe disease. It's a high grade of fever, shortness of breath, so you can't breathe, and it's so severe they have to stay in a hospital, get treated, and then small number of people, about 5% of the people infected with COVID-19, they need to go to ICU. They get so severe that they get the severe inflammation. Their saturation couldn't hold to sustain their life. Therefore, many of them in the critical care in ICU be intubated. They need a machine to help them breathe. Then, how long the virus can survive outside of our body? As in that picture that I showed you before, the droplet, people sneeze out or cough out, it can stay in the air for 3 hours. And for those fine, smaller droplets, it can even stay longer. And well, on the surface, it depends on the quality of surface. So on the cardboard, that virus can stay 24 hours. But on the plastic or stainless steel surface, that can stay 3 days. So now what about those plastic surface? Yes, your keyboard, your table. And what about this stainless steel surface, that your playground facility, all that. So think about it. When you use those things, if there's a suspicion, get contaminated, think again before you touch it. Now, anything that can and can help us to kill virus. I'm not talking about the drugs, the medications. Yes, we have a bleach, but 0.5% hydrogen peroxide bleach that can kill this virus, and 0.1% of sodium hypochlorite that can do that. 70% of the alcohol that can do that too, and the high temperature, like 52 degree in centigrade or 132 degree Fahrenheit, the heating for 50 minutes. That can kill virus too. UV light that can do that too. But when people use UV light to kill the virus on the surface, be careful because that can injure the skin. So make sure you turn it off before you get into the room. That also can injure the eyes too. Okay. We know more about the disease, the virus, and we know more about the disease. So the disease for this COVID-19, most people feel that it's like a coughing, shortness of breath, couldn't breathe. Yes, most of them are like that, but there are also interesting different findings too. So doctors found that those group of people more likely to have blood clots. The blood clots may in the veins, or it may in the arteries. So that cause, if it's in the vein, especially in the deep vein, that blood clots can cause the big blood clots in the pulmonary arteries. We call it PE. That can kill people very easy. And also that blood clot can happen in the arteries. So here's a picture of look at those blue toes. So because of the artery to the toes was blocked by blood clots. Therefore, those parts we call it ischemia, lack of blood, and most likely the patient will have to be amputated. So this is really a very vicious virus, and the blood clots in the brain can cause stroke, and in the heart, certainly heart attack. So, but fortunately, since we found this, and a lot of hospitals like Hopkins that where I'm working, they have a protocol for those people with COVID-19. We started anticoagulation at early stage, and to prevent those blood clots formation. Okay, so we just talked about the knowledge update about this disease, but you probably noticed that our medical system, systemically, actually, we made a lot of progress to help our people, help our patients. Telemedicine. So telemedicine actually it's been there for a while, but unfortunately for some reason it's not widely used, but this is a perfect time to use telemedicine. My office started telemedicine at Wuhan lockdown at a very early stage. We understand that there's a potential risk for patient to get infected each other. So now, at the second day of the American President Trump declared the state emergency, Medicare or CMS declared that it's okay to use the telemedicine, and I think the second day or third day, each state Medicaid service also catch up. They push to use the telemedicine, and then subsequently all the commercial companies, health insurance companies, they all agreed to support telemedicine. So because at this special situation, and telemedicine is the best time to use it. It's a safe and easy, and we can catch up the disease at early stage. So please use telemedicine. It's very, very, very important. Okay. If you have any concern, call your doctors first, but don't go to their office. Right now, most of the primary care doctors' offices they use telemedicine because for the safety of the patients. Okay, then testing. Yeah, at the very beginning of the pandemic, testing. It's we are so anxious with that, but America is such a strong country, and we are catch up very quickly. And now the testing basically is not a major concern now. So for COVID-19 tested primarily, we have two different tests. One is a PCR test, which is shown on the left side. Here's a drive-through test. So the nurse tried to get a sample from a nose of a patient. So PCR test is the one that we can test the RNA of the COVID-19. That's a direct test. Now, then the next one is what we call a serology test, meaning that we'll try to look at the antibody in the patient blood. So this is an indirect test. So usually the nurse need to take a little bit blood from a patient, and we check the patient has antibody to the SARS-2 virus or not. Usually our body reacts to the virus like this. If a patient are infected, then 2 weeks later, our body will produce antibody against that virus. So that's a basic theory behind this test. So usually, if it's especially IgG, that test is if it's positive, means that the patient was tested. Infected before. And the interesting part is that what people always ask, well, if I was infected, and then could be that I infected again. Well, the good news is that so far, right now, as I said, there's over 5 million people in the whole world already infected by this virus. But so far, we did not see a big group of people reported that reinfected. Meaning that look like the people do have immunity after the infection. But the question is how strong it is and how far it can last. We don't know yet because it's so new. But we can get some information from the brother of COVID-19, which is SARS. It happened 17 years ago. So the data from Hong Kong, which was the epicenter at that time for SARS, it shows that the SARS antibody actually can last about 3 years. But it's a little bit short. And for other diseases such as tetanus, a lot of people probably got a tetanus shot before. Usually the antibody lasts over 10 years. Okay, and then also you can see the difference and improvement in our health system too. Here's our frontline, our emergency room in the hospital. So the hospital have a different. This is a negative intent to accept COVID-19 suspicious patients. So for those people who have a high suspicion of the COVID-19 and also with symptom, and they come here instead of go to the go normal route to get in the hospital, which can possibly infect other patients. So right now, in general, it's safe, I would say. And here is the inside of the hospital. So we have a positive or negative pressure rooms, especially negative pressure room for COVID-19 patients. For those people who confirmed COVID-19, then they stay in the negative pressure room, and then all the air in the room will gonna suction out to a special ventilator and get the neutralizer. The virus will get neutralized over there. So to make sure that the virus does not get out of the room to infect other parts of the hospital. Those are ventilators. Yes, at the very beginning, we are terribly short of ventilators, especially in New York. But right now, look like in most of the states, they are good with that. In terms of Maryland, we also have a convention center at Baltimore. This is a beautiful convention center. But now we change it to a center to hold COVID-19 patients. So our system is ready for the fighting with the COVID-19. Now, and also we have a good coverage for the COVID-19 related problem to make sure that all those people with the COVID-19 were treated properly, promptly, in a timely fashion to avoid the spreading of the disease. Okay, and then now, so we're talking about the knowledge that we know more about the disease. The doctors and nurses, other medical professionals treat the diseases more comfortably, more confidently, and also systemically, no matter is it economically or medically, we all are better equipped to fight the disease. Now, what about the treatment progress? Well, treatment progress, yes, as I said, we're treating them more confidently. However, there's we do not have special medication. The magic drug, hydrochloroquine, unfortunately, more and more data shows that there's no clear benefit. And some of the data even show that it may even detrimental effect, a bad effect to patients. But the remdesivir, the latest data shows that it can shorten the hospital stay for patients, and in terms of a survival benefit, look like it did show some benefit in survival, although statistically insignificant at this time. But we're waiting for more data. This result is based on only 1,000 patients. Okay, and then fortunately, again, a patient with 80% of the patient, they have mild symptom, and those patients usually recover by themselves. And then vaccination. Vaccination. Right now, the vaccination certainly is our hope. All the countries, different countries, will try their best to come up find the good vaccine. NIH funded the vaccine research in Seattle, Washington, because that's where our first case come up. And hopefully before the winter, we can have the effective and the safe vaccine available. Now, as I said, a lot of states are open. American is reopening, but the question, are we ready for this? As I pointed out before, that the risk to the individual is not decreased after 2 months of lockdown, but instead our risk is increased. So although we are making a lot of good progresses, however, we do not have special treatment. So our best plan at this time for our community is still prevention. And before we are talking about prevention, I want all the parents pass this message to their kids that it's our obligation to protect ourselves, not only ourselves, but also for other people. Because if you're not protected, you're infected, and you can infect other people. So this is our obligation to protect ourselves. All right, so I would say the prevention not by yourself, prevention with the help of your PCP, your primary care doctor. So here I put a picture here is that this is a hen to cover the chicks. This is exactly like what we're doing right now, that I'm a primary care doctor. I try my best to protect all my patients. So that our medical system designed to do this. So try to understand the system and try to use it to get the best outcome for yourself. First of all, if you do have a PCP, give them a call if you did not see them recently, and make sure that your PCP is still open or what their services is, to make sure that they do use the telemedicine. If they don't, and suggest them to do that. As I said, all the insurance company, Medicare, Medicaid, they strongly support telemedicine, because this is the best way to reduce the risk of infection. And also, I believe if the doctor wants to see you in office, their office should be ready for the on-site visit. And the Maryland Department of Health has a requirement for all those doctors who will open their offices to see the patients. So we have to make sure that it's safe to see the patient on site. And doctors and nurses, especially as far as I know, our medical association, we have weekly at least update the progress in the knowledge about the disease or policies or that. So you may have a lot of questions. A lot of people say, hey, this days I got a lot of conflicting information. It's very confusing. That's true, because every day there's new data come up, and then then we have to shift our understanding of the disease. But all those information, new or old, any new issue come up, they need to be processed by a knowledge brain, by smart people, by group discussion, all that. So doctors start doing that all the time during the pandemic. They are not just sitting there only to see their patients. We are trying to catch up the latest knowledge, the best plan, figure out the best plan for our patients. We are here to help everybody. We are ready for that. So try to use it. And for your children, of course, as a pediatrician, give pediatrician a call to say what about the services, okay, to make sure you understand that, and to make sure that the quality, if you have any concern, you can talk with the doctor directly. Okay, and then what about yourself? Yes. So for yourself, I would say, if it's possible, try to test IgG. As I said before, the IgG, COVID-19 IgG is the one that, if it's positive, meaning is that the patient is infected already. Some people may have feel the disease, but some people may not. And as I said, in our neighborhood, in our community, we do have people get infected already, and then some of the small number of people are still infectious, and you may be infected already. You may not notice it. But if it is positive, then meaning is that your chance to get infected soon, chances is low. It's lower than those people who's negative. So actually, you have lower risk. So that this result can help you to decide a strategy to deal with the disease. And also, especially those people who need to go back to work, and those work environment maybe to have to deal with the a lot of people, high risk, high exposure, then I would definitely say, hey, check it. If it's positive, I would say, yes, you are kind of safe. But if it's negative, I would say, try to stay at home to work at home. So that's how important it is. Okay, now, yeah, we just saw, I showed you the picture about the face mask. And then I'm gonna show you a video. Oops. Oh. So this video was taken by Japanese medical professionals, medical scientists, and then show in the room how aerosol is spreading.
About 10 people
Okay.
in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the micro droplets shown in red continue to drift. This simulation uses only micro droplets. 5 minutes later, 10 minutes later, 20 minutes later, the micro droplets are still floating in place.
空気がよどんでいると、つまり空気の流れが
Okay, so from that video, then you can see that the respiratory virus droplets aerosol can spread very easily. Yes, we need to wear face mask, and then not only the one who coughs, but also those people who are inside the room need face masks too. But what about ventilation? Obviously, if we can use airflow within the room, that risk is going to be much lower. So actually, at the end of this YouTube, it also demonstrates that too. Yeah, now we're talking about practice social distancing 6 feet apart. CDC suggests that we stay at least 2 meters away and work at home if possible. It also means that avoid non-essential travel and avoid those crowded groups, and also beware of those high-risk people. And then there's a basic stuff. Yeah, wash hands 20 seconds and before when you come home or when you get out of the bathroom. Ask everybody to do that. And clean the car keyboard with the EPA approved disinfectant. As I said, that the virus can stay on the plastic surface for 3 days. And be very aware any COVID-19 positive cases in the neighborhood. And for those people from the nursing home, you try to avoid that. And if any question, ask your doctors. As I said before, that PCP, you got to figure out where your PCP is. Got to have a good relationship with your PCP, because you will need them a lot in the future, couple of months or probably years. So try to get a closer relationship with the PCP. Get their opinion. Get their help from the professionals, not by yourself. Okay, here we go. Now, what about children? Since here we're PTA. Then in general, still, the children here is at relatively lower risk than the rest of the population. But from here, that you can see that most of the people in America infected, I'm sorry, the rank number one is actually 20 to 44. Why? Because people get out more likely either for work or for entertainment, and then they certainly have higher chance to get infected. Okay, and then what about children if they get infected? Well, what does it look like? So the data shows that in America, we have here's the old data. This is a couple of weeks ago, I believe. So the highest percentage among the children who get infected is actually the one over 15 years old. Those people in high school. But I'm pretty sure you can understand. You understand what's going on. To people, those teenagers, they're friends. They can't stay at home. It's hard for them to keep the social distancing. And then in terms of severity of the disease, 51% of those people infected, children, I'm talking about children, is mild. So that's a little different from our general population, which is 81%. And moderate disease is 38%. And then, so this is much higher than a 14. And then, some of them, 7.4%, is very sick. They need to stay in the ICU or even get intubated. But in our general population, that is about 5%. So although children in general have less likely to get infected, but look like they are pretty severe if they are really getting infected. And interestingly, those you probably read about it. Those multiple pediatric centers in America found that children infected with the COVID-19 is more likely to have vasculitis, meaning is that there's inflammation in the blood vessels, especially the big blood vessels. We call it the Kawasaki disease. Okay, so look at children with the COVID-19, they have their particular risk and also particular clinical manifestation too. Since the audience, I believe in my age, you have children and you have elderly parents. Yes, I take care of a lot of elderly patients. Yeah, they are particularly high risk at this time. So for your parents, for grandparents of their children, they please keep them at their own home if possible, and also visit them regularly, please, because it's hard just to stay at home for so long. But visit them online, not in person. Now my mom lives in Rockville, so I visit her regularly by phone, online, video call, all that. I buy food, grocery for her, and I just leave everything in front of the door, and before after I clean all the stuff. And even I'm pretty sure they miss their grandchildren very much. Yes, please, but call them, visit them online, and do not have body contact with grandchildren. And if they have any problem, call their doctor, report it in a timely fashion. Don't wait. Okay, so I'm going to wrap up my talk, and then before I stop, I would say there's a couple points I want everybody try to take care of. Number one is make sure that every family member has their own PCP. Adults have the primary care doctor, children have their pediatricians. As I said, because you will need them, and you will need them a lot probably in the future. And monitor, number one. Number two is monitor symptoms for each family members, or even extensive family members, to make sure that if anybody is sick or if you suspect that the patient has COVID-19, report it to your doctor or to his doctor in a timely fashion, then we probably can stop the transmission within family. Number three is that you stay away from the high-risk people, including your parents. I'm sorry, but they are at high risk. Take care of them, but stay away for the time being. And also inform any concern to your doctors in a timely fashion. And lastly, I would say, if possible, please work as volunteers and protect our home, protect our community. Thank you very much for your listening at this beautiful weekend, and I'm open for questions, please.
Oh, thank you so much, Dr. Cui. Do you want to, let's invite Ms. Yuan.
Oh, yes, please.
She works as the registered nurse at the ICU unit. Maybe she can give us a few, some frontier, experience and information shared with us. Ms. Yuan, can you talk about a few? Oh, she's probably she's not online right now. Okay, I sent you, Dr. Cui, I sent you a few questions in advance. Do you mind to answer those questions first, and then we can start a question from the live audience?
Yeah, absolutely.
Okay. Do you have the question? If not, I can repeat that. That's okay. I can.
Yeah, yes, please. Yes, please. You can read it.
Oh, okay. I need the.
Okay, let me get this one.
Technique.
Okay, let me read these questions first. So what timely, reliable resources for parents do you suggest to stay informed of the COVID-19 situation, and then to make us our parenting decisions, like outdoor activities, in-person interactions, or sports activities, or that? What is the reliable resources to make those decisions? Yes, as I said, that there's a lot of information recently, and also some of the information keep changing. The best resources is your doctor, your PCP, your doctor's pediatrician. That's the most reliable resources. As I said, we are in the learning curve too. We are keep updating our knowledge. So anything that you feel uncertain, ask your doctor, ask your children's pediatrician, and they will help you. We are here to help you. Anybody have other questions?
Lily, you're on mute.
Okay. The second question, what criteria apply to determining when and under what conditions kids can return school with both a minimal acceptable level of risk and actions to be taken when inevitably another student has a positive COVID diagnosis? Did you answer that question?
Yeah, I believe all the children's, they are longing for going back to school. Yeah, unfortunately, the situation is hard, and the Board of Education, I believe they are working hard on this. And at this time, I would say they need to stay at home in a simple way. They use Zoom class or that. And then in the future, I believe there will be a lot of innovation before children really going back to school. As I said, they may need a strict protocol and to protect the children, and how to avoid those situations when one of the children was found to have COVID-19 positive. And do they need a screening before they go to classroom? Or the school classroom probably need to get a better ventilation, and all it will change our life. It did already, but it will change more. Yeah, there's a lot of things that's going to happen, and so at this time, I would say protect your children at home. Let them stay at home, and that's probably the best plan that we can do right now.
Okay. Here, there's another question sent in advance. It says, should I open some of my screened windows after all visitors leave my home? How long? Like 30 minutes, 90 minutes, or 120 minutes?
Well, first of all, I would say try to avoid your guests. And before they come, make sure they are safe, they are good. And if you're not feel comfortable, just tell them, I'm sorry, because this is a special time. I wish I would have you in my home, and to talk with them or chat with them online. And if they did come and you feel worried, well, you two things. One, you follow them up, and to make sure that a couple of days later, if somebody is really positive, yes, then you need to be self-quarantined. Number two is yeah, for the area that they touched, they wipe it with Lysol or with a disinfectant that the EPA approved. And room ventilation is a great idea. I would say keep it open all the time. If there's no rain, that'd be great. And keep in my own room, although I think I'm relatively low risk because I see the patient online most of the time. I don't see the patient in my office, but I still keep my room well ventilated. So because this is a good time, it's a very nice weather. It's not hot, not cold. Keep your windows open and I would say you try to feel that flow of the air. That's a fresh air. If you're not allergic to have a seasonal allergy, it'd be great.
Thank you, Dr. Cui. I hear some questions from chat. One, is it possible to get a false? Oh, Dr. Cui, you are on mute. You are okay. Great. Did you hear my question?
No.
Is it possible? Is it possible to get a false negative test?
Yes, it is. I would say if it's positive, and yes, it's likely that. Hold on, let me see. If it's yeah, if it's negative, then most likely you're not infected. But if it's positive, it can be false positive. Yeah, but I think the chances low. What I usually use is a LabCorp. Because the data that they give me is that sensitivity and specificity is very high.
Okay, another question is I heard that the Montgomery County is opening CVS for drive-through testing. So do people need to get a doctor's prescription for the drive-through test? Do you know?
As far as I know, yes. Yeah, most of the drive-through they need a doctor's test. I mean, order for the test. And I would say if you want to have a test and you do have a doctor, I would say give your doctors a call. Let your doctors do screening to say if you really need that test. Number one. Number two is that if because the doctor may find more information than simply a test, and he may suspicious something else, or usually a doctor, when they talk with you, not only you, if you are highly suspected, then your whole family probably would be same time be screening too. So I would say use the system. The system is really helpful, and right now the system helps. It's open to help all. Well, this system is built to help all our patients. And yeah, so I would strongly suggest to all those audience to use the system. I realize that look like more and more people, a lot of people just don't know how to use our health system. So that's why I keep saying this.
Okay, there's another question say, your patients, any one of your patients had the COVID-19?
Yes. And I put it, one of my patients came from the nursing home, and he was tested for COVID-19 for not, look like it's a, most likely it's contamination. So far he's asymptomatic, he has no symptom. And the only exposure is that he went to nursing home. Yeah. And I do have other patients who was positive for COVID-19. But in general, because I have a big proportion of Asian American in my patients, this group of people here, their risk, it's not high prevalence here.
Okay.
But the thing is that it can, as I said, the other community, our whole community, the infected patients are going up. Then for those people who are not infected, they are at risk.
Okay, one more question. Have COVID-19 patients reduced the capacity of the ICU at Shady Grove Hospital?
Well, I'm sorry, I really don't know that. I don't work in the Shady Grove Hospital, but Miss Yuan, who's a ICU nurse at the Suburban Hospital, I believe, and she may be the better person to answer these questions for Shady Grove, for Suburban Hospital.
Okay, Ms. Yuan, do you want to answer this question? I don't know whether she's having microphone issue or something. Okay, one more question. We'll talk with Ms. Yuan later. Because the parcels, the droplets actually can stay in the air for 3 hours. Should we wear masks when going out for a walk?
If you are in a crowded place, yes, please. If you can make sure that you have like 2 meters away social distancing, I would say yes. But if this is only very few people in a huge area, yeah, you don't have to. Because that the reason is when sick people cough, and then there's this air come out and very quickly diluted. It may stay there for somewhere, but if we don't have enough amount of virus on our nose, it's very unlikely that people are going to really infect it. But for those people who are high risk, I would say sick people, elderly people, on the safe side, yes, please. Wear a face mask all the time. Yeah, for normally healthy people, and in some area, in the area that's not many people, only a few people, you don't have to.
Okay. Can I ask one question?
Sure. Yes,
well,
please.
Regarding wear masks, I know in China it's advocated, promoted, like almost everyone wear masks. Does it have a very positive effect on how they can control the pandemic quickly? I mean, why our American CDC did not promote wear mask until very late?
Well, I don't know that. I'm not quite sure the situation in China. The situation in China is quite different from here, and they use a strategy of suppression and they use their political power to hold everybody at home very tightly. And not like us, we can work out. We can walk out of your house to have a walk. That I don't think it happened in China at that time. And CDC suggestion this time, yes, it's a lot of it's kind of I would say it's quite disappointing, especially for protection for our medical people. And my understanding is that this is because this is so new, it's such a large scale, and people are learning, including the CDC too. This is one thing. Another thing is that the short of medical PPE, including the face mask or surgical face mask, is a real situation. So hopefully after this pandemic, American politicians or American people need to think about the strategy here, that we have to produce something. And like Elon Musk and Andrew Yang advocate that American people need to produce. We're not only produce lawyers, we need to produce more entrepreneurs. So hopefully the TPA here, our Wooden, which is a very good high school, we can produce in the future, can have more successful entrepreneurs, and to help American people to build a lot of great things for our people, or for the people in the world. Thank you.
Okay. Ms. Yuan, she has a microphone issue, so she was not able to talk, but she provided the answer to the question regarding ICU Shady Grove Hospital. She said since last week, there are 20% decrease in ICU of COVID patients. So that's the answer. So looks now we have passed the time and we answered all the questions. We thank all the audience for joining this virtual meeting to get more information regarding COVID, so we can provide ourselves, protect our community. And we sincerely thank Dr. Cui and nurse Ms. Yuan take the time from their very busy schedule fighting COVID at the front line. We deeply appreciate it. Thank you. And this we can conclude this Zoom meeting. Thank you, Nikki, for hosting.